COVID-19 pandemic has had a significant impact on mental health globally. Discuss the psychological effects of the pandemic on patients and the interventions available to them.
So I think the COVID-19 pandemic had a really strong psychological impact on all age ranges, and I think it really differs depending on these. So I'm going to talk about them all individually. So if we start off with children, I think with the COVID-19 pandemic, with schools being shut and young children spending a lot of time at home, I think this will definitely had a psychological impact in terms of how they learn with emotional communication, how they learn to bond with people of a similar age. The younger years of our life are really important in the development of a lot of our key cognitive skills, and so they'll have really missed out on this, and that will have really had a psychological impact. And I think there have been some good interventions that have been put in place. I think the government has been giving extra support to schools with the reintegration back into class and really helping the younger ones develop their communication skills, which they might not necessarily have been able to do with online school and things like that. I also think adolescents, I think I read somewhere about the idea of depression and anxiety diagnosis rates really increasing, particularly in the adolescent population, due to the impacts of the isolation from particularly in the adolescent population. And I think the interventions that have been slowly starting to come into place, I think it's definitely improved since historically, is the destigmatizing the idea of mental health and really encouraging people to get talking with each other and to really come forwards to ask for support. And again, I think the schools have played a massive role in this, in how they're trying to offer support to them, whether that be through school or referring them on to other talking online services or local services. And then I think with adults, there's definitely a huge transition with them. Quite, I would say, large proportion of the working population have an office base or go into work and commute into work and meet lots of people that way. And the psychological impact of, not seeing their friends, working from home, staying in the same environment. And I think this definitely has impacted people. And occupational health, I think, has become a lot bigger thing, with occupational health really being involved with their employees' mental health and encouraging positive mental health, whether that be encouraging mental health walks or online chats with the groups of people whilst it was COVID, and really having a lot more, say, social media campaigns and things like that. I saw a lot of big companies and businesses really putting a lot of effort making sure that their employees, they're encouraging them to do exercise when they could, to walk, go out on walks and do all of those things like that. So I think there are some good interventions in there. And I probably would say one of the most impacted populations is the elderly. So the elderly typically rely on a lot of more face-to-face support. They don't necessarily have the same access to the internet, mobile phones, which a lot of the younger populations had, and that is how majority of people communicated in times of the pandemic, was online calls, online video calls, Teams meetings and things like that. Whereas the elderly weren't as used to using those kind of technologies. So I definitely think maybe some of the techniques that we use in the other populations for interventions for psychological help didn't work. So that led them to become more isolated. I think it would have been a very scary time for the elderly when they turn on the news and they see the elderly populations are the most vulnerable, and that can cause a lot of health anxiety and a lot of psychological pressure. So I think it's a very tough time for the elderly population. And so some of the interventions that were put in place is, rather than maybe video calls, a lot of elderly people had access to a landline, or things like GPs reaching out a little bit more and checking in on the elderly community to that they have the support that they need. we still wanted everyone to access their healthcare, and whether that meant home visits when they could and all things like that. So I think in general, the COVID-19 pandemic was really difficult on people's mental health and just general the psychological impacts. And I think there were some very good preventative measures put in place and implementations. However, I don't think that it should stop now. I think this is something that is going to have an impact on our society in years to come, and it's something that we need to continue with, encouraging people to talk about their mental health, encouraging people to get out and do their exercise and meet people. And I think it's a really good start, and it's something that should continue.
Vaccine hesitancy and misinformation have been significant challenges in the COVID-19 vaccine rollout. How can healthcare professionals effectively address vaccine hesitancy and combat the spread of misinformation within their communities?
I understand misinformation to be things that are spread that are not necessarily based off evidence and on truth, and particularly in the COVID-19 pandemic had a lot of scaremongering when it came to taking vaccines. And I think it's really important that we, within the healthcare system, really try to help target that. But I don't think there is a one-fit-all policy of how we can best combat it. I think it's really about having a personalised approach to each different scenarios. So, for example, I think in a younger population where there's a lot of online, maybe things that they're reading online, I think it's really important that the schools were getting involved to help educate on the facts and really be there to answer any questions. I think sometimes younger people felt maybe silly trying to ask questions or something like that, and really making sure that school is a safe and open place for people to ask questions about the vaccines, because, you know, it's completely normal for people to be inquisitive and to really wonder what's going on. It's a completely new time that people have never experienced before. And so answering all of these different questions in a safe environment, I think, was really important for schools. I think as well it's knowing that there is such a wide variety of different cultures and religions in the UK and how they may have different approaches to healthcare. And it's about personalising your approach to each of these individually, whether that is going to the local community centre or going to the local mosque or anywhere like that, where they can go and offer the information and help answer any of their questions. And again, I think it's all about making sure that it's a safe space so that people don't feel silly when asking questions and, oh, I think I read online X, Y, Z, and it's like, just trying to help clarify. I definitely think it's about recognising and monitoring, particularly in maybe places like GP practices where they can really monitor where the vaccine uptake is. Are they having a low vaccine uptake? And therefore they need to have more efforts of trying to stop the spread of misinformation. I think social media is a really powerful tool that can be used in both a negative and a positive way. And it's about really taking advantage of that in a positive way. I think I've heard about some of the new kind of algorithms and rules that are being put in place by things like TikTok, like Google and YouTube, where they really try to verify whether someone who is talking about medical information, whether they are indeed a doctor, do they have the qualifications to be talking about it or not. And I think it's really important that we are getting the information from the right people. So for GP surgeries to come out with their social medias as a recognised GP practice in the local area to really help spread good information. So I think in general the best thing is to have a personalised approach depending on who it is. It's not a one-fits-all policy of how we can help spread misinformation. It's going to come through multiple means, whether that's face-to-face, whether that's in the community, whether that's in social media. But I think it's really important that for people in healthcare to be really proactive about this, because it's really important.
Describe the potential impact of stem cell therapy on patients and the challenges associated with its implementation in the NHS.
So I've learnt about stem cells at school, and I think they are cells that can be taken, that can be reprogrammed and differentiated into any different type of cells. And so that could potentially have a big impact when it comes to healthcare and treating things. I think one that I've read about recently that might have a really big impact is the idea of CAR T cell therapies, and I think treating blood cancers. So the benefits of stem cells is first of all, they're not just treating the symptoms, but they actually have the potential to become a cure. And if we think about a cure, that's then going to reduce any further healthcare costs. So it's going to reduce the burden on the NHS. Also, they have less likely, they're less likely to be rejected and to have reduced amount of side effects compared to other treatments. So that's always a bonus in terms of health outcomes for a patient. We want them to be as happy and as healthy as they can be. So I think there are lots of positives when it comes to stem cells, but I think it's important to recognize that as with any new implementation, particularly with new technologies where they tend to be more and more complex and more expensive, is just the idea of cost and accessibility to the NHS. The NHS, we want to make sure that everything is available to all people, and no matter where they are in the country, no matter where they come from, and that's really important. And so I think the difficulties with rolling out stem cells into the NHS is making sure that we have the provisions and the resources to be able to do that. So I think in general, stem cells have the potential to be an incredible new treatment, but we really need to consider what we'll need to go into to implement this across the NHS.
Discuss the causes and consequences of burnout amongst healthcare professionals and propose strategies to promote physician wellbeing and work-life balance.
I think burnout's a really important thing to talk about within the healthcare environment. So if we first think about the causes, as doctors working night shifts, we know night shifts aren't good for our bodies. The emotional impact of life of a doctor, of having to break bad news and really help support families through incredibly difficult times and dealing with deaths, it's a big emotional impact, and it's really hard to separate yourself away from that sometimes, and you can really have a long-lasting psychological impact on us within the healthcare profession. We have such long training. It's such a long career where there is constant learning. And I think that's something that people underestimate sometimes. We're constantly having to try and keep up with the new research that's being published, the new guidelines, constantly trying to work our way up a ladder that it can sometimes not see like there's an end in sight, and that can become very overwhelming and leading to burnout. And this is going to have really negative consequences on our patients. If we are tired, we're not going to be able to make objective decisions. We're not going to be able to make calm decisions, and those are best for the patients. So that could result in a less good treatment being given. So patients' health can decline. So really quite a significant impact on the patients, most importantly, but also the impact on the doctors themselves in terms of mental health, sleep deprivation and stress. And we know that all of these can be risk factors in developing diseases like cancers. So not only is it impacting the patients, but it's impacting the doctors themselves. And if we think about the consequences of this, it's all just going to build on, and it's kind of a perpetuating cycle of it's going to impact us, it's going to impact patients, it's going to impact us again, and we're not going to be able to perform at our highest level. And so I think it's really important that we have measures in place to help combat burnout. And I think we can start off initially with preventative measures. I mentioned before about the idea of night shifts and making sure that the amount of night shifts per doctor is really monitored, that they're kind of spread equally among the healthcare team. I think it's also about encouraging people to, check in with each other and try and make sure that people notice if they're having a particularly hard time and an emotional time, and if they need that extra support at that moment to help prevent the burnout there and then. But I also think it's important that we have strategies for when and if it happens, whether that be trust-wide, with allowing people to take time off work without questions asked if we know that it's really going to impact on our patients. And really, I think it's important for individuals to recognise themselves when they're feeling like they need that extra support. And also, going back to the preventative measures, something that's really important is separating that work-life balance. Whether that be, for some people, it's exercise, being able to switch off from such a busy, overwhelming career and having something where they can make sure that they practice really good sleep hygiene so that then they're ready and raring for the next day. Whether that be exercise, going on runs, or practicing breathing and meditation to really calm down any anxiety. Or for some people, it's gaming or talking and going out with friends and things like that. I think it's important that everyone has a different approach and different things help different people. But I think it's really important that we take the initiatives ourselves to really take control of this, because we know it can be such a big issue. So to conclude, I think the lifestyle of a doctor can lead to burnout, and it's really important that we have preventative measures put in place and we also have ways to combat it, because ultimately it's only going to result in negative impacts on the patients if we don't do this.
Studies show that adult obesity is on the rise, with the percentage of overweight or obese people in the UK rising from 53% in 1993 to 64% in 2021. Is obesity a personal or public problem, and what steps can be taken to address it?
Okay, so I understand obesity to be an excess in body fat. And I think typically from what I'm seeing, it's measured via BMI, body mass index, within a healthcare setting. So obesity, obviously, as it says in the question, is becoming more and more prevalent, and we know that it is a risk factor to certain diseases such as cardiovascular diseases and cancers. So I think it's really important that we combat it. So if we think about it from a more public healthcare problem, I think there are multiple ways that we need to try and combat it. First of all, I think education and awareness within the general populations on living a healthy lifestyle, whether that be exercise, whether that be encouraging the 5 a day, whether that be encouraging people to have less sugars. And I think it's really important that this comes from multiple different places, whether that be on a more national scale in terms of adverts, like government run adverts, that whether that's on the TV or if they're on the side of buses, it's really important that it's being seen from that perspective. I also think it's important that GP practices, maybe particularly in more prevalent areas of obesity, to really make a conscious effort for adverts in the GP waiting rooms, to, in terms of social media, really utilise their social media to advertise the benefits of a healthy lifestyle. And also in terms of a GP on a more medical basis, also there are weight management referral services where they can refer people on to help them with weight loss. There are also things such as gym bursaries where they give discounts on gym memberships to help encourage people from all backgrounds to go and exercise. But I think it's really important to acknowledge that not all people have the same access to healthy foods and with the ability to exercise and go to gyms, whether that be because of cultural or socio-economic factors. I think particularly in low socio-economic areas, I associated with high rates of obesity. Healthy food is really expensive. You know, if you go into the supermarket, you look at fruits, you look at vegetables, they're really expensive, and especially in the cost of living crisis and the lack of support that is being given to these people, that it's really difficult for people to make these healthy decisions. It's not easy. They will have to sacrifice other things, whether that be supporting their children, whether that be, you know, themselves in terms of rent, in terms of anything like that. There has to be compromise for people, and often it's quite hard to make that decision to spend more money on the food. And I think it's about acknowledging that and really offering extra support, food vouchers that encourage people to spend it on healthier alternatives. I think is really important, and to really have a community outreach specifically for people like that, to really try and take initiative. So while I think all of these are really important, that we as healthcare professionals and the general public and the government, things like Public Health England, which typically tend to run the national campaigns, but it also requires a personal level as well. You can be provided with as many resources and as much education, but it really requires a person's own initiative and drive to make these choices. And it requires a certain mindset and a certain energy. If you fall into a pattern, it can often be really hard to break that comfort zone and to transition into a different lifestyle. And so I do think it also requires a personal push, but I do think majority of it should come from public health and from healthcare professionals to really help encourage. So to conclude, I think the rising obesity crisis is something that we really need to combat, and I think it's about collaboration. I really think it's about healthcare professionals and the public leading the way and helping encourage the personal people to take on that initiative.
News reports indicate that there has been a surge in mental health issues among young adults in the UK. How can the NHS address the growing demand for mental health services among young adults?
There's been a huge growing demand for services, particularly in the younger population, since the pandemic. I think I've read that the anxiety and depression rates have really increased, and so we want to make sure that they're having the best support they can. And I think that can occur in different ways. I think it needs to start with preventative medicine, but also to make sure that we're getting the best management that we can, whilst also making sure that there is follow-up and support available throughout the whole journey. So if I think about in terms of diagnosis, I think at the moment there are around 2-year waiting lists for diagnosis of some things like ADHD and autism. And now 2 years, especially at such a young age where there's key developmental things happening, you know, people are going to school and they're having to try and work and push through this without the support that they deserve. I think that's really difficult and will obviously have negative impacts, whether that be their education, whether that be their relationships and friendships with family and friends. So if we think about it just in terms of waiting list times, so we really need to increase our training, whether that be, I know of CAMS, which is, I think, the Child and Adolescent Mental Health Services, which is a really specialised secondary care team that really tries to work with these people. And I think we need to encourage training throughout the multidisciplinary team. So not just doctors, but also mental health nurses, physicians associates, and people like that. So we can really have a whole team to collaborate to really help these people thrive. So I definitely think specialist training is something that we need to encourage. In terms of management, I think GP tends to be the primary care, tends to be the first people in terms of management, particularly when it comes to anxiety and depression. GPs are regularly now prescribing antidepressants and anti-anxiety medication. I think it's about continuing this and educating and destigmatizing throughout the schools. I think schools can have such a key impact on adolescents and young people with helping encourage them into a safe space. And I think it's about making sure people are aware that the GP can help. The GP, it doesn't have to be medication, that they can refer on to talking services and for therapy and support, whether that be on an individual one-to-one basis, but also in a group setting if that's something that appeals to more people. So I think it's about destigmatizing going and seeking healthcare when in need, but also that it's not just one treatment that fits all, and that we really can help find a personalized approach to that individual. And I think the big thing is follow-up and making sure that vulnerable people are really supported, whether that be while they're being treated, whether from the diagnosis all the way through to being treated and maybe potentially being discharged or taking off medication, to know that the support is always there for them, knowing who to call if they are in times of crisis and when they do need that extra support, which I think is really important. And with that, I do think it is just funding and costs in helping to widen our services to really offer care across the whole span. And I think that has been partially carried out by the increasing use of telemedicine. I think it means people can access the follow-up care a lot easier. It doesn't necessarily have to be a one-to-one meeting. They can happen quicker, they can happen remote and at more convenience to people, which I think is important because, you know, life continues for people, and sometimes to be coming back and forth to appointments and things like that when they're trying to get things back on track, I think telemedicine is really good. But one thing I think that isn't maybe talked about enough is the idea of the limitations of telemedicine. I think some people, particularly young people, they really need that face-to-face, one-to-one communication to really build that rapport, to really help feel like they are in that safe space to talk about mental health and to really feel like they're being listened to and that they can get the support that they need. So whilst I think telemedicine is really great for convenience, for speeding up as much as we can in terms of waiting lists and accessibility to all, but I do not think that it should completely replace our services because there still are those people that need that support. So to conclude, I think there are several different ways which we really need to try and help combat this mental health crisis in the younger population. I think it needs to go all the way from preventative to the management and treatment, all the way to follow-up.
The NHS has embarked on a digital transformation journey, including the implementation of universal electronic health records. Explain the benefits and challenges associated with digitising healthcare information and the impact on patients' outcomes.
So I think it's had benefits on both patients and clinicians themselves. If we think about the clinicians, the idea of transitioning from paper notes to online notes means that they can easily be looked at. It means that we can quickly search for a patient if we have a query. It means that referrals and transitions and letters have become digitized, and it makes everything so much quicker and so much more accessible. Particularly with speed. Also, if we think about reception staff and how they contact patients now, we can contact patients through texts. Patients can send a picture, say if they have a skin lesion that they want to get checked out, instead of having to call a receptionist to book an appointment to then go and see a GP, they can now text a picture, and then if the GP wants to prescribe a medication, they can just prescribe it from the picture rather than having to go through everything. So it's really speeding up a lot of processes that typically used to take a long time. But also it's had a really positive impact on the patients themselves. The new thing is the implementation of patients being able to access their own records because of the whole digitalization of everything being on computers and being easily shared. It means that patients get to view all of these things. But that also has its consequences of making sure that notes typically are done in say, doctor's language, where it's aimed at another doctor reading it, and sometimes medical literacy from patients isn't always the best, and they're not necessarily trained, so they might not understand it. So this can cause some health anxieties. It can potentially cause them to feel like they need to contact the doctor more to clarify and actually maybe slow down the process. So I think it has both its pros and its cons in this sense. But also the whole idea of general digital health and healthcare, it can reach so many people so much easier and so much quicker, whether that's social media, whether that's through emails and things like that. I think that's something that we shouldn't underestimate. So I think in general, the digitalization of healthcare has really improved our speed, our efficiency, and the wealth of education and information available to patients, but also making the life of clinicians easier in terms of the transition and minimizing kind of the admin work so they can focus on treating the patients as they should. However, I think we do need to consider cybersecurity. Having digitalized health records means that we are potentially more susceptible to cyber attacks. Specifically, the idea of having one system across a lot of NHS trusts, which a lot of people are really wanting to push, because that means there's less training if you transition from trust to trust or hospital to hospital. It means it's a uniform policy for all to learn, which makes it easier, but that also comes at the cost of it being more susceptible to attack. So to conclude, I think there are so many benefits from the patients, for the clinicians, for the digitizing the healthcare, but we also need to ensure that we are protecting patient data, confidentiality, and ensuring that there is confidence within the healthcare system.
Discuss the implications of antibiotic resistance on patient care and the strategies that can be implemented to tackle this global issue within the NHS.
So antibiotic resistance is becoming increasingly more a problem. Diseases that we could easily treat with antibiotics years ago are now becoming more and more difficult as the antibiotics are no longer working when we're having to seek out other treatments. So if we think about that on a treatment level to begin with, patients that are in hospital, if they have a bacterial infection which cannot be treated by the medication, they're having to go on multiple medications at once and worrying about the drug interactions and the side effects of that. But also the rise of superbugs. Things such as MRSA are becoming increasingly prevalent in hospital. And I think MRSA is a super resistant bacteria which we can't really effectively treat. And that can lead to mortality, which is obviously incredibly sad when antibiotics used to work for these. So I think it's really important that we make sure that we are dealing with antibiotics in the correct way. And that can start with doctors who are prescribing, making sure that they are prescribing specifically for bacterial infections, not viral. So making sure we are having the right diagnosis, whether we're making sure we're doing the extra testing to identify specifically which bacteria it is so that we can make a narrow choice on what antibiotic we are using, which is most suited to killing that bacteria. But I also think it comes from the patients as well, and the idea that patients really have an education and an awareness of antibiotics and what they are used for, that once they are started that they need to take the full course, even if they're starting to feel better. That's really important. And not if they just have some antibiotics left around in the house, that if they're starting to feel ill, they don't just take them because it's a magic pill. Antibiotics are incredibly specific things. So I definitely think patient education is really important. I've seen, Public Health England campaigns which are really good of, little jingles on adverts, whether that be on the radio or the TV, making sure that people know that antibiotics are for bacterial infections, not viral. And I think that's really good on a national scale. Like, I know I can sing the song in my head now, something like that. It's really incredible because it sticks with patients, and then they really make a conscious choice when they're thinking about antibiotics. So to conclude, I think that it's really important that it's both the doctors' initiatives and the people and the pharmacists that are prescribing to make sure that they are prescribing specifically, but also on patient awareness and education into making sure that they are using them correctly so that we can prevent any further antibiotic resistance occurring, because there has been a real decline in the production of new antibiotics. We are really struggling to develop, and particularly in the big pharma world, really struggling to develop effective antibiotics that can tackle these new resistances. So it's really important that we do all of these things to make sure that we can treat patients as effectively as we can.